order this subcommittee of the Psychedelic Medicines Working Group meeting to order today. It is 8:35 a.m. Again, this is a virtual meeting only as authorized pursuant to NRS 241.023. Members of the public may hear and observe the meeting and participate in the meeting either by video or phone, and members of the public may also provide live public comment during the public comment sections of the agenda. And if members of the public desire to provide a pre-recorded or public comment for the meeting, it could be authorized before the meeting by the public body. And again, we still have one more formal meeting in December, so you will also have opportunity to comment and provide written pre-recorded public comment prior to that meeting. As required by open meeting law, this meeting is public, containing this agenda, and this meeting will be recorded and the minutes will be completed following the meeting. And any of the supporting materials may also be obtained online at the DHHS website. And if you're on here, you probably know all that information, but I just wanted to make sure I put it on the record for clarity. And with that, we will do a roll call. Do I do the roll call, or is there someone that does the roll call, Marla?
I'm happy to do it.
Oh, perfect. Thank you.
Mark McBride.
Present.
Senator Wynn.
Present.
Assemblyman Carter. Jonathan Dalton.
Present.
Dustin Hines.
Present.
So, Madam Chair, you have a quorum.
Okay, thank you. And at this time, we will open this up to a public comment. Again, action may not be taken on any matter brought up under this agenda item until scheduled on the agenda for a later meeting. But to provide public comment telephonically, please dial 1-775-321-6111. When prompted to provide the conference ID, enter 943-484-956#. If you are providing public comment during the Teams meeting, unmute your microphone prior to speaking, and persons making comment will be asked to begin by stating their name for the record and spelling their last name. So I will start here with people that are on the Zoom. Is there anyone that would like to provide public comment that are on this Teams meeting virtually? Let's see. You can either raise your hand, you can just unmute yourself, you can wave me down, you can just start screaming if you're on telephonically, whatever you think you are, and I will go ahead and call on you. I see, go ahead. I see just a hand. I don't know why. I just have a random hand here.
Can you hear me? This is Dr. Shad.
Oh, okay, go ahead.
Yeah. So I was just going through this. Everything looks okay, and I don't have any issues, but there was one thing under the mechanism of action and therapeutic process, and that says that notably psilocybin has been shown to reduce reactivity. That is not true, because psilocybin increases amygdala activity, not reduces it. So we need to correct that, and I can give references and send you the articles on that. And the second thing is that the contraindications, there needs to be an addition to that. Not only SSRIs may be contraindicated, but more importantly, antidepressants and medications which block 5-HT2A receptors should also be carefully used, because that can minimize the effect of psilocybin.
Do you have any other comments? I know we're going to have in agenda item number 4, a discussion of that draft report for consideration. So we can talk about that. Do you have any other comments about the process that is not limited to that, or is that it?
Yeah, I'm sorry. I didn't realize you were not addressing that. I was just making a general comment.
No, that's fine. That's fine too. And we can also include it as a part of the minutes for the discussion of the draft report. Does anyone have any public comment outside of that report? And then if we don't, we can just go ahead and jump. Is there anyone on the phone lines to discuss that, Marla? Do you know if anyone's called in?
No, nobody's called in.
Okay, with that then, do we see last call for public comment? I don't see anything. So with that, I'm going to close agenda item number 3, which is public comment. There will be another opportunity for public comment at the end of the meeting. And at this time, I will go to agenda item number 4, and up for discussion is the draft report by the subcommittee that we are hoping to be able to present at the Psychedelics Working Group meeting, final meeting in December. It has been up for about a week, and again, it will remain up if it comes out of this subcommittee group until that final vote with the full committee next month. So there are possible opportunities if we find something that comes out and we determine, you know, between now and then that there are some things that need to be done, because it will be published again, continue to be published for the public to view and make any comments in that other additional public comment section. So with that, I heard what you said, Dr. Shad. Is this something, the things that were included in this report, do you have problems with them being included in the report because they weren't presented that way? Or do you have problems because the information that was previously presented in that report is incorrect? Does that make sense?
Yeah, so basically, I reviewed the report, especially relating to psilocybin, because that's my area, which I worked with in previously. So I just looked at that, and I didn't have enough time because the residency interviews are going on, and they're so busy these days. Uh, so I was able to look at that, and I thought that the people who know the mechanism of action of psilocybin should not be that is a statement which needs to be revised. Yeah.
I for the people that were working on the drafting, like specifically, what section are you talking about, Dr. Shad?
Yeah, sorry. I should have told you. I said mechanism of action of psilocybin. Yeah. It says mechanism of action and therapeutic process on page 23.
Pulling
And
that
so,
up.
sorry,
Does it,
I'm on this subcommittee to help draft this. I'm confused with a couple things. So are you saying that we didn't get the mechanism right, or it's not complete and you would like to add something to it? Because those are two different statements.
Yeah, I will repeat it. I said it, I thought clearly that uh, that psilocybin does not suppress activity of amygdala, it activates it. And that is a major neurobiological difference between SSRIs and psilocybin, because psilocybin acts in completely paradoxical way to other antidepressants. There have been multiple functional imaging studies in which SSRIs have been shown to reduce the amygdala activity, but
Yeah, but
psilocybin activates
so
it.
I would vehemently disagree with that on 2 points. Number one, we could add something like that, but then we would be in a digression of going anatomically from every area of the brain that these drugs work on. The typical protocol is to talk about where the receptor works and what receptor it's working on. And
Yeah,
so
but
you could get in a loop talking about what the prefrontal cortex does versus the amygdala, because they have oppositional roles. So typically what's done in this space is just talk about the receptor itself. And that's what we've done for mechanism of
yeah,
action, really talk about two
yeah.
ends.
I'm sorry, Dr. Dustin, you put that information there, so it's open for discussion. So now you put it there, and you are now saying that we need to look at that. And if that is wrong, we cannot correct that. Is that what you are saying?
No, what I'm saying is if we took your approach, we would have to look at every anatomical area of the brain. I don't
You
think that's
but you didn't. But you didn't. You only looked at amygdala, right?
No, we're looking at not at that level, right? We're looking at the level of the receptor and at the level of the behavior.
so I'm gonna kind of bring it back here between the two of you. This is what I'm concerned about. I think we could get into an academic discussion about this. What I am curious about is what was actually presented during these working groups. We cannot supplement that report with additional things that we would like to be included.
I'm not asking to supplement. I'm just asking to revise that statement because based on the Robin Carhart studies, he's the major functional imaging expert who has done reviews after reviews, studies after studies. And I'm quoting him that he says amygdala is activated, not suppressed. So if that is not important, the group can decide about that. But my job as a neurobiological psychiatrist is to tell you the facts about that because that is not a right statement. That's not a correct statement.
So I have a question. That statement that's included on page 23, was that presented, that specifically, was it presented during the presentations?
No, I don't think so. It was presented like this. Otherwise, I would raise the concern.
Okay, Dustin, I don't know if you worked on this portion or if John worked on this or if Mark, you worked on this. I'm assuming probably Dustin, but I don't know.
So we all worked on this, and to be clear to everyone here, I'm absolutely not disagreeing what Dr. Shad is saying. I'm just saying we didn't talk about the anatomical areas in depth in this committee or in the subcommittee. And so what we did for the report is just look at a mechanistic level. And I think we could fill out mechanism. The mechanism for psilocybin is not well known. I'm a world expert in it. I've done studies on it. There's more to be figured out there. And to break it down at the level of a single brain area on a single study, that study's correct, exactly like Dr. Shad is putting forward. But somebody's going to look at the prefrontal cortex in the future and find something different. So we made it very simple, and we talked mechanistically about really receptors and single areas. Because when you get into other diseases, different than say major depressive disorder, and you maybe look at addiction, you'll have to look at a different area like the basal ganglia. All that is useful information, but in the scope of this report, we're not going to put every single anatomical area, single.
Dr. Shad, the report that you referenced and the study that you referenced, was that presented to this committee?
I refer to my article. I send the article, which I've done a review of all the functional imaging studies. It's all over there. I actually not only talk about amygdala, I talk about all three major neural tracts in the brain, which are the most important ones. And if somebody would have looked at that, they would have clearly understood that amygdala is not suppressed. It is activated for a transient period of time. That's the whole mechanism difference between psilocybin and SSRIs. And the argument that we are not talking about neuroanatomical structure, I agree with that. But then why did you bring up amygdala? Because that's a wrong statement.
Is this necessary to the report to even have this included in this portion?
But the report is undermined by wrong information. What if somebody who knows about this and reads it and says this is wrong?
So what I'm at, that is why I'm asking, is this like a crucial aspect of this report?
Yeah, it is, because you're trying to separate the mechanism of action of psilocybin from other antidepressants. And that is the hallmark actually of the activity of psilocybin, which distinguishes it from SSRIs. SSRIs blunt amygdala activity and create emotional numbness, whereas psilocybin does not cause emotional numbness because it desensitizes amygdala rather than inhibit it. So those are the key roles of psilocybin.
Okay, so I'm gonna talk about this. This report is presented not for doctors. I'm gonna put that out there. So that's why I'm asking, like, is this section that has to do with this, like, very, very specific scientific medical, like, determination necessary to the presentation of this entire policy document?
No, the thing is that I'm a neurobiological psychiatrist. Maybe I'm biased, but if you are going to report something, it has to be accurate. What if somebody like me reads the paper, right? What if somebody who knows the psilocybin effect, neurobiological effect of psilocybin, which I've done a review on. That's why I know of this stuff. My argument is the committee can decide whether to change it or not. But if you want to change, if you don't want to change it, remove it. It's inaccurate. It's not a good reflection on
And
the
that's why I'm asking, can we just remove that section since it obviously causes there's
That right now.
clarification issues.
I'm happy to remove that. Absolutely happy to remove that.
Good. Okay, perfect.
Okay, done then. Thank
Mark, Mark, I
Yeah.
see your hand is patiently waiting there times two. So
Yeah.
go ahead.
No problem. Thank you, Senator. So a couple of things. I think that I don't think it's critical that it we can remove that portion. I know that the abstract, there's only so much that we can include on this, and we have to look at our audience. Many of the data that we present is subject for discussion, but we had to limit the scope that we went in here. So I don't think it's critical that it's included.
I would suggest, and I think it's included in there, John Dalton put in the chat, perhaps we simply remove the sentence regarding reduces activity in the amygdala. And I don't know if anyone has any objection to that. I think the integrity of the report is still maintained. I think the concerns that Dr. Shad has about like inaccuracies on what is included in there, would be satisfied if we remove that. I mean, again, if there's confusion, the couple of things that I want to make sure that we're not doing is that we are not adding reports and studies and research that were not presented during this thing, during the months that we've been meeting in order to come up with this report. Does that make sense? I'm sorry, I see something else in the chat here from Kate Cotter, and it says, note the sentence is reduces reactivity. And then it says important difference. Kate, would you like to speak on this?
Yes, I just wanted to point that out. And I also think it's a pretty easy fix to reduce that or to simply take out that sentence if there's a debate about it. But in defense of the research, I thought it was important to note because it's an opposite meaning if you say reduces reactivity versus reduces activity.
Okay. I suggest that we just remove it completely.
Sounds good.
Does anyone have any objection to that?
No.
No? Do I see any objection to that? Okay. I know, John, you had indicated that there were some typographical or concerns that you had or some things in there. Do you know if they were ultimately corrected, or would you like to state some of those things that need some correction?
Sure. Thank you, Senator Wynn. John Dalton for the record. We actually, yes, I did mention that there was some just some minor things in the table of contents. The page numbers were off a little bit, and then the formatting was we looked at this collectively, and the formatting and the citations, we were the way that we had it, we saw another way that would read better, and so we actually redid the formatting and that table of contents, and we could submit to Marla. We already did the work on it, but it was only formatting, citation, just the formatting differences, not a change to anything in the in the body of the work. And again, table of contents was simply some page number skewed, really just to just make sure that it's looks professional and that it reads easy for the reader. Yeah, that's it. And I can submit
Does anyone have any objection to making those changes officially to the document that we submit to the committee as a whole? All those in favor say aye, so I can see, or raise your hand just so I can see. Okay, perfect.
Aye.
Perfect. And then, so
Madam Chair, just
yes.
along those lines. So it's Detective Josh Garber. It's not Sergeant. And then I think Mark McBride, his title is not corrected, accurately reflected in there in the draft I have.
Mark, what's your official title?
Deputy Director, Healthcare Services,
Perfect.
or
So if
NDVS.
we could, does someone have the best working copy of
I
that
do.
document that would
We
make
do,
those
we all
changes?
do on that shared subcommittee draft, and I
Okay.
have it up and we can change that. Not a problem.
And John, I just wrote
John?
that down. I can work with
Okay.
you to do that too.
Okay. Do we see any other like substantive issues or any clerical issues? Or any, want to make sure that everyone has their correct titles and names on there. Do we all have that as well?
So if I could, Senator.
Go ahead.
So as you know, this is a committee that was assigned to the Department of Health and Human Services. And so we have an internal process for review. I don't, we will take the final copy, but I just want to let everybody know that the department will apply its own formatting perspective to it as well. So I hope that that's not too upsetting to anybody. And if it is, let me know and I'll carry that message back to the department. But they did have some, some initial comments about, I think on page 2, and it talks about including the need for equitable access across Nevada's rural communities. It's the paragraph that starts, the framework must also address several critical challenges. And they're just, what does it mean in terms of equitable access and underserved communities in that paragraph?
I'm looking at page 2 right now. You said and I read that same thing this morning, so I'm trying to see it again. You said it was the first paragraph, a second?
No, it was the fourth paragraph that starts, the framework must also address several critical challenges.
That was, I believe, when we were pulling from the original, who was it that did it for the working group 1? It was the document that for basically Nevada mental health. I can, and so we can take a look at that. We could certainly pull it. I think what it meant was that what that brief in that first working group was discussing was that there's these healthcare shadows or deserts that are not don't have the appropriate healthcare therapists and what have you. If you
was it attributed to somebody else who said it? I think that's probably all we need to do is attribute it to them. They said it.
Let me pull up. Let me go to the working group page. I'll go to the first working group and I'll pull the document. I could do that while we move on if we want, or you can just wait for me.
Yeah, and I can see Marley in that because I have it up also. It says the study before that. So I think what we can do is cite the study there. And then I think that would address.
That should be easy. Because I actually can just about recall the slide that it was on. So let me just see something here.
Does that clarify for you?
Yeah,
Marla?
like I said, if it's just cited to it, then that makes it easy for somebody to go back to that source.
Yes, ma'am. We can do that.
Thank you.
Easy. Yep.
Do you have any other concerns that you've heard from your agency?
The only other one is so the next page in the mental health in Nevada. So again, just attributing wherever that data source is in that paragraph as well.
Okay. Do you want to tell me specifically or the whole thing? I see. You know what, ma'am? Here's the deal. Yes, easy. I believe the reason why in the executive summary and the summary key findings it's not attributed is because those were pulled from the main body, which has the attributions. And so the question will be, do we need to then reattribute everything that's in the executive summary and the summary key findings? Because all of that data from summary key findings, executive summary, was pulled from the body, which should be cited to that first.
Yeah, I think maybe just then a quick a sentence in there saying, this is a summary documentation confirming these findings and the summaries are located later in the document. That will clear it up.
Perfect. Okay. Yeah.
Thank you.
That is, yeah, absolutely. That explains to me. Now it's clear. So, and I also pulled it up, but by the way, just for the record, it's from the behavioral health and substance use in Nevada statistical overview was one of the areas. So we'll get that squared away. Okay, and I might reach out to you separately just to make sure that our language is appropriate with how you want that and where you want that.
Sounds great. Thank you.
Okay.
And actually,
Do you have
thank
any other concerns, Marla?
No, no other concerns.
I'm sorry, Dr. Hines, do you have some additional comments?
No, I was just going to thank her because John and I actually struggle with that because I'm a reference monger. I wanted them everywhere, and it really did slow it down. So a quick sentence like that, I think, helps say, this is somewhere else in the document. So that's a great fix. Thank you.
Do we have any other comments, concerns, things that need clarification? I just want to thank this working group. I know that you guys have worked really hard. I want to thank you, Marla, because I know that you have also, you have a lot going on right now as well. And this has become a project that has probably taken up much more of your time than you ever anticipated. So I appreciate your patience with us as we're going through this, but I really do appreciate you all really paying attention and including the people that were not necessarily on this subcommittee working group, like Dr. Shad. I'm more than thrilled that people are reviewing the document, want to make sure that it is an accurate reflection of the work that we've done, and that it has that kind of like historical snapshot of the work that we've done and moving in and guiding future legislators and executive agencies as they, try to figure out what kind of policies we want to move in this state. So I appreciate all the work that everyone has done on this. That was kind of agenda item number 5 as well. Sorry, I didn't formally announce that, but any recommended changes to that draft report. Again, I'll remind the public and anyone watching, as well as the people that served on the subcommittee that also serve on the committee as a whole, or the working group as a whole, there still will be an opportunity should we, see something that obviously should be, changed before that meeting. So with that, I'm going to close agenda items 4 and 5 and move on to our last period of public comment. Again, the same number applies telephonically, 1-775-321-6111. When prompted, the conference ID number is 943-484-956#. And again, I will start while people are giving people the opportunity to call in telephonically to see if there's anyone. I know some more people have joined the Teams meeting. So if there is anyone else there, I see your hand still raised, Dr. Shad. I don't know if you have another comment in public comment or if this is just a holdover. But if it is, I will go to you first. Dr. Shad, do you have anything further for the last period of public comment? May have gone back to residency interviews.
Let me unmute. Sorry. Yeah. No,
that's okay.
I apologize. I should take that off here. Yeah.
Do you have any other comments, or did you?
No.
Are you fine?
No, I think the
Perfect.
report is really perfectly done. I was very impressed with the work they have done, except that one item which I didn't agree with. Yeah. Thank you so much.
Do we have any other items on here for public comment? Seeing none, Marla, do we have anyone on a telephone line?
No, we don't.
Nope. I don't see anything. With that, I will go ahead and close public comment. Thank everyone for your hard work on this subcommittee meeting. And at this time, what is the date scheduled for the final meeting, Marla?
Elvira, do you know off the
Elvira
top of your
Saldana,
head?
for the record, it's December 13th.
Thank you. So I will just, before I adjourn this meeting, I will say that the final meeting, where again, we will discuss this as a working group, whole working group. This report will be voted on for recommendation for a presentation by the end of the year as required by statute and the bill on that December 13th date. And again, it will be virtual only. And so we will see you all again. So meeting adjourned. Thank you, guys.
Thank you.
Thank you.